many as 40% of women over the age of 35 have fibroids. That's between 50% and 80% of women. And if you look hard enough, a woman will have several fibroids in her wombs, which will have different sizes but will not know. To better understand fibroids, it helps to know how your body works, so the signs don't pass you by.
Fibroids are the most common growths in a woman's reproductive system. Many women with fibroids have no symptoms at all, while others have symptoms ranging from heavy or painful periods, discomfort or swelling in your lower abdomen, backache or pains in your legs, urinating frequently, constipation. Fibroids are tumors that grow in the uterus. They are benign, which means they are not cancerous, and are made up of muscle fiber. Fibroids can be as small as a pea and can grow as large as a melon. It is estimated that 20 to 50% of women have or will have fibroids at some time in their lives. They are rare in women under the age of 20, most common in women in their 30s and 40s, and tend to shrink after the menopause. To treat fibroids, your doctor may recommend medication. However, in most severe cases, surgery can be considered.
Our guest in studio this morning to talk about fibroids and to create a clear understanding of fibroids, Dr. Rose Kiura. Welcome to the program.
Thank you very much.
All right, let's start with I was going through my reading. People would have fibroids and not know. Why do you think this is?
Because, well, that is true. Only about 25% of the people who have fibroids will actually have symptoms, and that is the only way that you're going to know you have fibroids. About 20 to 40% of women usually have fibroids, but only a quarter of those will ever know that they have, or most of them will just be found during a routine examination.
Okay, so then what are fibroids and where are they found?
Fibroids are usually just growths which are consisting of smooth muscle, which is what lines the wall of the uterus, and so those are just overgrowths that occur within the uterus. Okay? There are usually several areas where you can get the growth of the fibroids. You can either get them on the outer layer of the uterus. You have a covering, okay, what is called on the inner layer we have the mucosa, which covers the inner layer of the uterus. In the middle layer we have the muscle layer, which is called the myometrium, and on the outer layer we have a serosa, which covers the outer layer of the uterus. So the fibroids can be located in any of those areas.
Okay.
You can have
individually, or also you can have many fibroids?
You can have a mixture of fibroids.
Okay.
You can have one underneath the mucosa, which is called a submucosal fibroid. You can have one within the muscle, which is called an intramural fibroid, or you can have one outside, which is called a subserosal fibroid. Some of them usually grow even with a stalk, so you find a fibroid that is connected to the uterine wall with a stalk, and then you get the fibroid, okay, which can occur inside the uterus or on the outside of the uterus.
Okay, so these are growths inside the uterus. What causes this? I mean, do women need to do something to get fibroids, or is it genetic? Stalks?
Yes.
Okay, so it's a growth with a stalk.
How? Not necessarily. Some of them.
Some of them.
Some of them. Yes.
So who is predispositioned to get fibroids?
Well, as long as you're a female and you're in your reproductive age group, meaning that you're from puberty and you haven't gotten to menopause yet, then everyone there is at risk of getting a fibroid. Okay? There is no exact known cause. There's no one thing in particular that you can say is what causes fibroids. Okay? There are just factors that are known to increase the risk of fibroids.
Okay, let's talk a bit about those factors.
Well, one thing is genetic abnormalities. Okay? These are just theories that have been passed. There's no way that you can test and find out whether you have that genetic problem. Things like certain growth factors which influence the cell growth within the body, if those then become have a problem, then you can get them having an overgrowth of a fibroid. Okay, if you have a family history of a fibroid, anyone else in your family, other females who had fibroids, then you're more at risk of getting a fibroid as well. For race is also a factor. People who are of African descent, people who are black, usually seem to have fibroids more than the Caucasian females.
Do you know why that is? Is it because we eat so much soul food?
Not really. In terms of lifestyle, Well, overall, we seem to have a better lifestyle than in the Western countries,
Yes.
okay? Because people tend to eat more healthy. That may be associated with the socioeconomic status.
Okay.
But that does not seem to play a factor, because blacks then tend to have more fibroids, about 2 to 3 times more than the Caucasians.
Okay.
Okay.
Okay, so let's carry on with the risk factors.
Another risk factor is nulliparity. What is called nulliparity? Nulliparity means if you haven't gotten a child yet, the older you are, then the more at risk of getting a fibroid that you may be. It is seen to be this way because estrogen, which is one of the hormones that is produced by the ovaries in females, is the one that seems to affect the growth of fibroids. And so if you haven't had a child yet, then it is supposed that you've been exposed to estrogen much more than someone who has had a child and had the progesterone that came in during the pregnancy. So the longer you wait, they say that you're more at risk of getting a fibroid.
Wow, that's very interesting. So before we carry on with the facts and understanding what fibroids are, why is this such a disease that many people fear, or many people should worry about, especially women? Let me not say people, women, because it affects many parts of the body.
Well, I think the main problem has been there's a lack of understanding. Okay, most people, the perception that we've been getting from the people on the ground is that they always think that if you have a fibroid, then you may have to have your uterus removed, which is a misconception. Okay, it is not always that if you have a fibroid, then that is the end of your fertility and we're going to remove your uterus. That is not a fact. Okay, there are other treatment modes that we can consider, hysterectomy being one of them, but it is not a hard and fast rule that we have to remove your uterus.
And
if
when
you
you say
have fibroid.
hysterectomy, what exactly do you mean?
Hysterectomy is the surgery that is done to remove your uterus, okay, which is one of the options that you have as a treatment for fibroids.
Okay.
Yes.
Just talking about talking to you earlier, the 4 Fs I think are important to talk about: fertility, fair, 40, and fat. Are these some of the factors that would contribute to a woman in her late 40s or her late 30s getting fibroids?
Well, those Fs are usually guidelines, yes, but they are, as I alluded to before, they are the factors that usually